Good afternoon, Varlies, and thank you for joining us today for our 11th core series session. During the series, we've touched on sleep and its importance in our cognitive health and our well-being in general. Sleep plays an integral role in our health, and today we'll look at a closer look at sleep, how it works, and how we can optimize our sleep. We've all heard at one point or another that we should get around 8 hours of sleep at night. But how many of us are actually getting this much? And how restful is the sleep that you're getting? With our busy day-to-day lives, it can sometimes be difficult to switch off. And some people may even boast that they do not need 8 hours of sleep at night. As we've covered previously in the series, we need to take a step back from glamorizing work styles that are causing burnout and focus more on our well-being and what's needed to maintain it. Something that is crucial, though, is definitely a healthy amount of sleep. Today's speaker is Tanya Moore. Tanya is a qualified occupational therapist from Wits University. She qualified in 2012 after gaining experience in both adult rehabilitation and pediatrics. She realized that most of her clients required sleep intervention, as sleepiness and poor routine had a significant impact on her clients' road to recovery. She went on to learn about sleep health and completed an advanced diploma in pediatric sleep training, studied sleep neurobiology and the assessment and intervention for sleep disorders, and will soon be accredited as a fatigue management consultant by BSS Africa. This has afforded Tanya to have a special interest practice focused on consulting and sleep intervention for both sleep disorders and sleep difficulties in patients across the lifespan, and is now spanning her work in sleep intervention across mental health, rehabilitation, pediatric, and corporate settings. Welcome, Tanya, and thank you for being with us today. We're so eager to get your insights on sleep, and which is a very underrated, and the underrated role rather it plays in our well-being. Over to you.
Thank you, Andile. Thank you, everybody, for having me. Let me share my screen. Right, I trust you can see this.
We can see on our side.
Thank you. Thanks, and I'll get going. So thanks again for having me. There is a lot to cover when it comes to sleep. There's a lot of information. So I am going to just talk straight on through it, but we will have time for question and answer at the end, and I can clarify anything that I may have gone too quickly over. So please do ask questions throughout, but in the Q&A, but we will cover them at the end of the talk. So Andile gave me a lovely introduction, so I'm not going to spend too much time on this, but basically I am an OT and I've done some extra studying on sleep as I realized it was very important for recovery, and it's just becoming a very hot topic in health and wellness. And there aren't any OTs really in South Africa that are looking and focusing in on sleep. And I run a practice called Sleep OT. It's a sleep health consultancy. So I'm a sleep practitioner, and I'm also a allied subcommittee representative on the South African Society for Sleep and Health, which is a new society, and I'm very excited to be representing them today as well. So today we're going to look at how sleep works. It's very important to understand your biology around sleep so that you know how to work with your biology instead of against it. We're going to look at the effects of sleep deprivation on health, the signs and symptoms of common sleep disorders, and then we'll look at evidence-based sleep hygiene, which are really just tips and strategies that have been proven to work in helping optimize sleep, even not in the presence of a formal sleep disorder, but where you just have maybe some sleep issues. And we'll look at options for treatment or when to seek help. And then we'll have some time for questions. So every night, and for a third of our lives, we all humans, in fact, all species enter a period of altered consciousness at some point. And for us, it's during the night normally. And in that time, there's reduced activity, decreased responsiveness to the environment. Though many theories exist, some of the main purposes of sleep are believed to be rest, restoration, to grow, to consolidate, to detoxify, refresh, and process. So before, most people would think of sleep as just the opposite of being awake, just time off from being awake. But there's actually a lot of processes happening during sleep that are extremely important. So sleep and wakefulness are controlled in the brain with different hormones to activate different pathways in the body. So for example, melatonin for sleepiness and cortisol for alertness. And we're going to look at two systems in the body that assist with helping us get to sleep. So the first is known as sleep pressure. This is a system that promotes sleep when one has been awake for a long time. So on average, about 16 hours. And it's really the propensity to go to sleep brought on by the use of energy. So as the day goes on and as we use more energy, this builds, this pressure builds. And then when we go to sleep, it dissipates. This is measurable by how much energy we spend during the day. And as you can imagine, having a nap would relieve some of that sleep pressure. But then we know it needs to build up to a specific amount of pressure to be able to then go back to sleep at night. So what's interesting to note here is that caffeine, the caffeine molecule, is very similar to the molecules involved in the sleep pressure. And it has the ability to trick the brain into thinking there hasn't been much use of energy as there has actually been. So this reduces the feeling of sleepiness, even though the need is still there. Once caffeine has been metabolized, the brain suddenly realizes that there is a buildup of sleepiness been happening in the background, and you experience what's known as a caffeine crash. And so you have another cup. The second system we're going to look at is called our circadian rhythm. You may have heard of this before. This is the natural rhythm of chemical release in the body over an approximate 24-hour period to initiate various processes in the body and at appropriate times, such as temperature control, blood pressure, hunger, alertness, and sleepiness. And we're going to focus in on the rhythm of sleepiness, which is controlled by melatonin. Melatonin production is sensitive to the absence of light, in particular, bright blue light. When blue light waves enter the eye, a signal is sent to the brain to inhibit the production of melatonin so that it allows for alertness. And when that light is no longer perceived, the brain is signaled to begin melatonin production and therefore bring on sleepiness. The level of melatonin builds and then peaks at around 3 a.m. to help maintain your sleepiness. And then it begins to wane to allow for alertness when the sun rises. So whether you are asleep or not, this melatonin rhythm doesn't really change much. It responds mainly to light and temperature changes. So just to look at it from a picture point of view to help you understand, this graph illustrates how melatonin production and therefore your level of sleepiness is regulated over the 24-hour period. So for example, if you can wake up early in the morning, the melatonin doesn't really rise that much during the day. It does have this peak during the afternoon, which is sometimes, it's normally after lunch, and you kind of think it's because you've had a heavy meal, but it actually isn't. It's a normal rise in melatonin during the afternoon when you start to feel a little bit sleepy and could do with a nap. But then it actually goes back down to normal and you kind of feel like you're alert again for the afternoon and evening. And then it begins to rise as the sun sets. So when the light starts to disappear, our melatonin starts to rise. And that's really important. It's a really important part of our biology to understand because we can work with that or we can work against it. And then, as I said, it peaks during the early hours of the morning and then it starts to come down again so that we can wake up. All right. Here you can see a graph of the two systems I've spoken about that are in your body, and they're independent of one another, but they both have the same goal, which is to bring on sleepiness. So here in white is your sleep pressure, which has been building up through the day, and then you might choose to go to sleep around 9 o'clock, and then it comes down again while you're sleeping, and you want it to come back down to an almost zero so that when you wake up, you feel refreshed. And then the melatonin in blue, which we've just spoken about. So when sleep pressure is at its highest, we want it to be a similar timing to the increase of melatonin so that that feeling of sleepiness is overwhelming enough to get you to fall asleep easily. So for example, if you're going to nap, here's an example of napping, how napping can change that. So your sleep pressure is going to build as usual, and then you might have a nap in the afternoon because it's quite easy to with this rise of melatonin. But your pressure is going to come down because of that nap, a little bit at least. And then it still needs to build. It's going to build after that, but it's not going to build as quickly or as early as you'd like to be able to go to sleep at, let's say, 9 o'clock again. So it's going to take much longer, or it's going to be much later before you feel enough sleepiness to go to sleep. And then what happens is you get less time to sleep because you still have to wake up at, let's say, 6 o'clock. And at 6 o'clock, your sleep pressure is actually still a little bit high. And so when you wake up, you're not going to feel refreshed. And then an example of how we can influence the melatonin. So if your sleep pressure is still normal and your melatonin is normal to begin with, but then at night you are exposed to bright light, and especially bright blue light, what you're doing is slowing down the production of melatonin. Because remember, melatonin wants the sun to go down to be able to come out and to help you go to sleep. So if you are exposing your eyes and your body to bright light during the evening, your brain is not 100% convinced that it's nighttime. And so the production of melatonin slows down a little bit. And this can then affect how well you sleep, so the quality of your sleep. We don't all have the same circadian rhythm. So some of our body clocks are a little bit different. Although they all still run on about 24 hours, the propensity for sleep can be at either a later or an earlier time than others. And this is known as a chronotype. You may have heard before a night owl or a morning lark. You just like to sleep at different times than others. And there's actually 4 types now in literature called the lion, the bear, the wolf, and the dolphin. And this picture just quickly, I wanted to show you that we might not everybody is go to sleep at 9 and wake up at 5, and not everyone can do that quite easily. So it's important to understand what your genetic predisposition is when it comes to your circadian rhythm. And these are your natural wake up and wanting to go to sleep times without feeling sleepy in the day. I'm just going to move forward from this slide. Okay. So next we need to look at the architecture of healthy sleep. How do we know what healthy sleep looks like in the average person? So sleep scientists are able to draw up a detailed picture of a person's sleep using what's called polysomnography, which is in a sleep lab, a gold standard multi-measure of sleep behavior. So it measures and observes changes in brain waves, eye movements, muscle activity, cardiac and breathing activity. And all this information gives us an idea of the quality of sleep by looking at the various stages of sleep. So you may have heard that there are 4 stages of sleep. For the purpose of this presentation, I'm going to talk about 3 stages of non-REM and 1 stage of REM. And REM stands for rapid eye movement. And this makes up 1 cycle. A cycle is basically from REM to the next REM. And we go through about 5 or 6 of these stages, of these cycles, per night. So there's 4 stages in 1 cycle, and you'll go through 5 to 6. It takes about 90 minutes to go through the full cycle. And there are natural awakenings between each cycle, so it's normal to wake up. We normally don't remember though. And then sleep onset is, on average, to fall asleep is about 12 minutes. So normally if it's taking you longer than 30 minutes to fall asleep or quicker than 5 minutes, then it indicates a problem. So if we look at these stages in a little more detail, non-REM 1 is a very short stage. It's about 5 to 7 minutes. And it's really, the purpose is really to slow us down to be able to go to sleep. Non-REM 2 is next. And there our body temperature drops ever so slightly. Our respiratory or breathing rate drops. And this stage is really important for a specific type of memory called declarative memory, which is about consolidating facts that you may have learned that day. And then non-REM 3 is next, and this is really known as deep sleep. This is where someone is really quite difficult to wake up, and it's a really important stage for growth and repair. So your growth hormone is released during this stage, and it's where either children are growing or adults are repairing cells around the body that have been damaged during the day. And this is the only time that your body gets time to repair. And then it's also a stage where the brain is going through a process of pruning. And what I mean by that is the brain cells, your brain picks up so much information during the day. And so this is the time where the brain decides what's important, what needs to be thrown out, and what needs to be kept. So we call it like neural pruning. And the idea is just to make space for new connections and stronger connections. Then we go into REM sleep, which is essentially your dream sleep. And during dream sleep, our muscles become essentially paralyzed. So the brain stops signaling to the muscles. And it's believed that the point of this is to make sure that we don't act out our dreams, because as you can imagine, that can be quite dangerous. And it's also during REM stage that there's a lot of information processing happening, where deep sleep was about making space for more information. REM sleep is now about making those connections nice and strong. So the new information that's come in, we're now making associations to existing information in the brain, and it's really an important part of the sleep for memory and for learning. And then lastly, during REM sleep, it's also really important for the brain to regulate emotions from the day. So this is really where things are balanced out from an emotional point of view, the emotional part of the brain. So people with mood disorders, or even just if you've just had a really bad emotional day, REM sleep will prove to be quite important and quite therapeutic if we can get it. So this diagram is called a hypnogram, and it's a representation of somebody's sleep and the sleep stages over the night to show the cycling. So this is just a typical hypnogram. There's nothing special about it, but it's quite a typical representation. So what you'll notice is that from being awake, in the first few minutes, you'll drop down to non-REM 1, into non-REM 2, into deep sleep. Spend some time in deep sleep, which is represented by the blue line, and then come back up through the stages into the black area, which is your REM sleep. And that's one cycle. You might wake up here, you might not, and then you go back into another cycle and into another REM, and here's an awakening, and then back down. So really what's significant about this picture that I'd like to point out is that the first half of the night, quite interestingly, we spend more time in deep sleep than we do in REM sleep. And in the second half of the night, we spend more time in REM sleep than we do deep sleep. So between those two stages, they are or they're not well spread out over the night or over 8 hours, for example. So if you are going to be sacrificing the first half of your sleep, you're going to be sacrificing that very important deep sleep. And if you're going to be sacrificing and waking up really early in the morning, you're going to be sacrificing some REM sleep, which we know is also important. This table is fairly recent, from 2017, and the numbers can vary across sources, but the majority recommend that healthy adults should be 7 to 9 hours per night. So it's not just 8 hours on the dot. There is a range. 7 to 9 is considered healthy, and this is per 24 hours. So if you're regularly getting less or more than this, so 6 or less than 6 or more than 11, more than 9 and up to 11, that can be quite, that can indicate a problem with your sleep. And you're probably experiencing symptoms that are related to sleep deprivation. There is a tiny percentage, and I mean less than 1% of the global population, who can cope quite easily and healthily with less than 6 or more or up to 11 hours. So 7 to 9 is your good one. But quantity is not all that we look at when describing healthy sleep. So good sleep is characterized by quantity, but also quality, which looks at depth and consolidation, so not being interrupted. There's no use getting 8 hours, but of light and interrupted sleep. Okay, so next we're going to look at sleep deprivation. So what are the effects of sleep loss? We know what healthy sleep looks like. Look, unhealthy sleep affects and leaks its way into all parts of our life. It affects mood and motivation, our mental health, relationships, learning, immunity, productivity, physical health, safety, and as an offshoot from productivity, affects economical cost to company or to the country as a whole. So we're going to look at some of these in more detail. So looking at some physical effects, when you haven't had enough sleep, we all know that you feel physical fatigue. You just can't move your body. It can't get going. You have an impaired immune system. There's growth suppression. You have a low sex drive. There's changes in appetite, whether that means wanting to eat more or not having appetite. Increased heart rate variability, a decreased physical reaction time, and decreased overall temperature. And having a change in your body temperature means that certain processes just can't take place. And then on a cognitive or psychosocial level, we talk about mental fatigue, memory loss or lapses, impaired judgment, hallucinations, impulsivity, decreased psychological reaction time, cognitive reaction time, irritability, injury and accidents, and hyperactivity actually in children. And all of this means we have an increased risk for chronic diseases like obesity, type 2 diabetes, and the list goes on and on. There's a lot of research backing all of these chronic illnesses and they're linked to sleep deprivation. If we look at productivity, there is some research that was done to show that the cost to a medical aid of treating these life-threatening diseases because of sleep loss was estimated at 247 million rand per annum. And then in terms of safety, another study done on medical residents, so those studying medicine who are essentially shift workers, they followed their sleep patterns and looked at the cognitive loss. And it showed that there was an increase for motor vehicle accidents. So what's quite interesting here is that the cognitive performance, so the ability of your brain to think clearly after one night of sleep deprivation, equates to that of somebody who's legally too drunk to drive. So in the study, it was 0.08 blood alcohol level. And in South Africa, our legal limit to drive is 0.05. So it just shows that driving drowsy can be as, or if not more dangerous than being drunk. So here's an example. It's just a quick video to show you what kinds of things can happen if you are nodding off while you are driving. So that's a catastrophe. Yeah, this guy wasn't wearing a seatbelt either, but he just nodded off for like half a second. So it can be very, very dangerous. Please don't drive drowsy at all. Some interesting information. So men who only get 5 to 6 hours of sleep per night have a testosterone level, which is that of a man 10 years their senior, compared to those getting 7 to 8 hours of sleep per night. I'm going to skip over this one. So daylight savings is a global experiment really that happens every year with 1.6 billion people across 70 countries. And it shows that when we lose 1 hour of sleep, the very next day, when they change their clocks, the very next day, there's a 24% increase in heart attacks. And then when they change their clocks again with 1 hour extra, the next day there's 21% decrease in heart attacks. That's quite significant. This was a very good study done. And then in terms of immunity, your natural killer T cells, which are these awesome cells in our blood that are important for fighting cancer, change their activity after only getting 4 hours of sleep, just for one night. So if one night you have really minimal sleep, you wake up with a 70% drop of natural killer cell activity. So your immunity is really impaired after being sleep deprived. Individuals that are getting better quality sleep are perceived to be more alert, more attractive, and more youthful. There's 46% of individuals who have frequent sleep disturbances report missing work or events or making errors at work. That's a high number. Sleep loss impacts hormones that are involved in appetite regulation, and this is why obesity can occur as a result of sleep loss. And then out of 409 medical schools in 12 countries surveyed in 2011, the average time spent on sleep education was 2.5 hours. And I just want you to know this because it's quite, in my experience, I've spent a lot of time doing these kinds of talks with health professionals because your GPs, your doctors, your physios, your dietitians, your even some specialists are not well trained on sleep. And so they tend to ask the wrong questions or not enough questions. And we have a serious problem with underdiagnosing of sleep disorders in the world, not only in our country. Now, I want to make you aware of what high-risk populations there might be for sleep disorders. People with mental health disorders can really struggle with sleep, whether it's anxiety or depression or post-traumatic stress disorder. And this is often a bidirectional relationship. So if you're struggling with anxiety, you tend to have bad sleep. But if you have bad sleep, you're probably going to have worse anxiety, for example. Adolescents or your teens tend to struggle with sleep because of their changing biology. Their circadian rhythm that I spoke about, their melatonin is quite different. It actually naturally only peaks a little bit later than adults, up to 2 hours later. And so they tend to just go to bed later, or can only go to bed later. And they also want to wake up later in the morning. And they often can't because of school start times, and so they end up with poor daytime functioning because of this. In late adulthood, there is a higher risk for sleep problems, and this is also due to changing biology, changing activity levels in the day, and they're more likely to suffer from periodic limb movement disorder, which I'll talk about just now. Your frequent travelers struggle with jet lag. Pregnant women, because of hormones, parents of babies, well, that's self-explanatory. Shift workers, people who are ill or have chronic pain. And here I just want to make a quick note about post-COVID insomnia. So if there's anyone listening who's had COVID, or even if they haven't had COVID, but they are struggling with sleep because of lockdown. Sleep deprivation is particularly relevant at the moment because there's a serious and worrying increase in sleep and fatigue complaints, with people changing routine, being isolated, feeling depressed or anxious, and obviously those who are becoming ill. And the NHS actually found in 2020 that 50% of adults have been reporting their sleep is more disturbed. So it is a serious problem at the moment. And in fact, we are calling it coronasomnia. So if insomnia is new for you and it's sort of since this whole pandemic, it is already well recognized in the medical field and can be treated. So your inpatients in hospital, if you've been in hospital before, you know that you do not get good sleep, which is counterintuitive because that's where you need to recover, and that happens during sleep. People with developmental or congenital disorders struggle with sleep, and those with traumatic brain injuries. So if you've had an injury to the head, it's very likely that you'll struggle with at least fatigue, if not insomnia, or you might still have pain or trauma that affects your sleep. And then in the workplace, so this is quite pertinent for today's talk, you've got to think about where you are working and what kind of environment you are working in when it comes to how the policies and the environment encourages or discourages good sleep. So often workplaces encourage fast-paced after-hours work and poor health management, but I'm glad that Broll seems to be on top of this. Working long and late hours can be seen as heroic or hardworking, and it in fact affects productivity in the long run. So scheduled and unscheduled napping should be encouraged in workplaces to prevent injury and poor productivity. The napping should never be seen as laziness, but if somebody needs to nap, it should be investigated, but it should also be an option in workplaces. Companies like Google have sleep pods where they encourage their employees to take a nap if they need it and then to get back to work. But there is a limit on this, so 10 or 20 or 30 minutes can help to increase different parts of the brain activity, to help with creativity, or just quickly to sleep off some of that sleep pressure and then get back to work. So working from home, which is under a current reality for everybody, is also affecting your ability to sleep. This is because we need to know how to separate work from rest, and that's what we're going to look at just now in terms of the environment. Working where you sleep is not a good idea. Maintaining routine, as we did before, getting out the house, and as part of your routine, eating at the same times that you would during the day, getting a break from the computer, and not suffering with digital fatigue. All of these are going to affect your sleep. So just to look at some common sleep disorders, I'm going to start with insomnia, which I'm sure many of you have either heard of or experienced. And it's really defined as a predominant complaint of dissatisfaction with sleep quantity. And then it's difficulty either initiating sleep, so being able to go to sleep, or being woken up a lot during the night and not knowing why, or struggling to go back to sleep after being woken, or having early morning awakenings without being able to go back to sleep. And a lot of us have this from time to time, but if this is really a problem if it's happening like 3 or more nights a week, and for 3 months, then a diagnosis is given. So how do you know if you have insomnia? Well, there's many types of insomnia. You can fill in these subjective questionnaires with a sleep practitioner. You can keep a sleep diary to see what your sleep patterns are. And then CBTI, or cognitive behavioral therapy, is the first line of treatment for insomnia before any type of medication. So if you have not explored behavioral interventions for insomnia and you are struggling with insomnia, please do this before relying on sedatives or benzos or whatever your doctor may or your chemist has given you to try and sleep. There are other options that are non-pharmacological. So common signs that you can look out for: daytime sleepiness, like excessive daytime sleepiness, attention, concentration, or memory impairment, social, vocational dysfunction, or poor, well, for you will be work performance, mood disturbance or irritability, motivation or energy or initiative reduction, proneness for errors or accidents at work or while driving, tension, headaches, or gastrointestinal symptoms, so tummy problems, concerns or worries about sleep, or bedtime avoidance. So really just feeling like, I don't want to go to bed tonight because I know it's going to be a horrible night. We also have another sleep disorder called hypersomnia, which is characterized by wanting to sleep more or needing to sleep more. So it's not about struggling to go to sleep, it's actually struggling to stay awake. And it's not only about excessive daytime sleepiness. This can be because of a medical condition, and it can also be called narcolepsy, which is a genetic problem. And this is where people just fall straight into sleep during an activity. So the activity is not enough stimulation to keep their brains awake, and they just go into a REM sleep. And this can obviously be very dangerous. And it is very limiting for these people because they can't assume or engage in normal activity necessarily, or normal work or drive and things like that. So it's quite severe, but it's not curable, but it can be medicated. Then another common sleep disorder that is very underdiagnosed is known as obstructive sleep apnea. And this is a breathing disorder during sleep. And it really is the cessation of breathing, so the stopping of breathing during sleep that causes low oxygen saturation. And it's normally as a result of a blockage in the airway, so an obstruction in the airway. Some symptoms might be daytime sleepiness, and often these people don't even complain about their sleep. So they're tired during the day, but they say, but I sleep fine. Normally they snore, but not always, but most of the time these people snore quite loud. They hold their breath during the night, and normally the bed partner is either complaining of very loud snoring or watching the partner gasp for air or holding their breath. Risk factors for this, so who would have this? More your people who are obese, above 60, who are men and women who are postmenopausal. But this does not rule out, there are many, many children who have obstructive sleep apnea that is misdiagnosed. So these are just risk factors. And the treatment for this is CPAP, which is a mask that fits over the nose and mouth normally, that pumps air into the airway just to keep it open so that normal breathing can take place. We look at weight loss options, and we do positional therapy because in a lot of cases, people who sleep on their backs struggle more because of the neck weight that causes the obstruction. So we look at helping them to sleep in different positions. Okay. And then we have another disorder that affects our circadian rhythm, where the body clock is shifted. I've spoken a little bit about this, but we get a type called delayed sleep phase type, which is the common one in teens, but it can happen in anybody, as well as the advanced sleep phase type, which is common in the elderly. So that's more of an earlier bedtime, an earlier wake time. But this is known as a disorder because it's actually affecting their daytime function. So it's not, if it's just a case of biology and they're still coping, that's okay, if this is normal for them, but we don't want it affecting the daytime function. And then we get shift work disorder, which is really irregular sleep and wake times. And the problem with shift work disorder, which you normally see in people like paramedics, nurses, truck drivers, security guards, is that they struggle to sleep during the day when they're on shift because they have to sleep when it's light and noisy, and they struggle to sleep at night when they're off shift. because of this change, constant change and regularity. They have a high risk for burnout, illness, and substance abuse. And shift work is actually known as a probable carcinogen, so it can cause cancer, according to the CDC. That's how bad it is for the body. And obviously, it has an impact on work and family life. Another sleep disorder is a parasomnia, which is your abnormal movements and thoughts and behaviors like sleepwalking, night terrors, nightmares, sleep eating, and one called REM sleep behavior disorder. This is when during REM, the brain doesn't give the muscle the signal to switch off the muscles, and so people actually do act out their dreams, and this can be incredibly dangerous. Then we have sleep-related movement disorders. I'm just going to focus on two common ones called restless leg syndrome, which speaks for itself. It's overpowering feeling while you're awake to want to move the legs, and so it makes you struggle to go to sleep. And then periodic limb movements, which is during sleep. And this is sort of involuntary flinging and kicking of limbs, and normally it's the bed partner that also complains about this. So now I want to help you to know when to seek help. So are you experiencing excessive daytime sleepiness? Your partner's complaining of disturbing behaviors during your sleep. You struggle to get through a day alert without use of stimulants or medications. You struggle to get to sleep without use of sedatives or alcohol. And your work productivity, safety, relationships are taking a toll due to low energy levels, low mood or irritability, or risk-taking behavior. And where to seek help? So you can go to a GP, and I'd really suggest that you find one that does know more about sleep. Otherwise, being referred to the appropriate specialist. Neurologists and pulmonologists often do overnight sleep studies to help diagnose obstructive sleep apnea. This is something you're worried about. The psychiatrist will help with sleep disturbances that might be due to an underlying mental illness. And then you can look at consulting with a sleep practitioner who does a sleep assessment, sleep coaching, and environmental adaptation to help you sleep, and energy management during the day. This is something that you really struggle with. And the last section I'd really like you to focus on now is called sleep hygiene. And these are some of the tips that are evidence-based that should really help anybody who's got sleep problems, even if it's not a sleep disorder, but you're just really struggling with sleep at the moment, struggling with daytime sleepiness, but you don't think it's an actual disorder. These things can help you prevent sleep disorders like insomnia. And even if you do have a sleep disorder, these sleep hygiene principles are going to take the edge off. They're going to help a little bit with coping with your sleep disorder, depending what it is. So the first one is to keep a regular sleep and waking time. And this is to keep your circadian rhythm aligned. If you wake up at the same time every morning, including on the weekends, so you have one wake-up time, if it's going to be different, it shouldn't differ by an hour, and the same bedtime every night. This is really going to help you. I always start with this one because my clients find it helps within a few days. They can already start seeing a difference. You also want your caffeine intake to be before 2 p.m. So yes, we want to limit the amount of caffeine we're taking in per day, but we also want to stop our caffeine intake after by 2 p.m. And this is because caffeine takes a really long time to be metabolized in the body. And so you still have half the amount of caffeine in your body up to 7 hours later. And if you're going to try and go to sleep, you might really struggle if you're sensitive to caffeine. And just remember that caffeine is not only in coffee. There is a considerable amount of caffeine in normal tea and also in chocolate and other medications, in fact. Then we've got alcohol consumption. So if you are drinking in the evenings, to rather finish those drinks 3 hours before the expected sleep time, so that the alcohol can be out of your body. Alcohol affects the onset of REM sleep, so it delays that REM sleep until much later in the morning, and you might not get enough of it and won't feel refreshed upon waking. Exposure to sunlight is really important. Remember, we spoke about melatonin being sensitive to light. We want when the sun comes up, we want to trigger our circadian rhythm. We want to trigger our melatonin production to stop. So we need exposure to sunlight first thing after waking, and then at least 30 minutes per day. We need to remind our bodies what time of the day it is. If you're always wearing sunglasses or blue light blocking glasses all day, or it's sitting in LED lighting from start to finish of the day, your body's not going to go through a rhythm. It's going to be very confusing. So exposure to natural sunlight is really important. Then, as we all know, we have to exercise, and 15 minutes a day, a minimum is okay, and it's helpful for sleep, but not within 2 hours of wanting to go to sleep. it takes a long time for the body to come back down to a baseline of good temperature and a heart rate to be able to switch off at night. So 2 hours is a good time to leave between the end of exercise and wanting to go to sleep. And then we need to limit nicotine in the evening. So if you smoke, can't have a cigarette just before bed and expect to go to sleep. Nicotine is a stimulant chemical. Next, we want to adopt a 1 hour at least, or probably start at 15 minutes if this is really hard for you. Tech-free wind down routine before bed. A routine is really important because it builds associations in the brain about when sleep is coming. So you want things to kind of run in the same order every single night. And without technology, because we want to disconnect, we want to get away from the day, we want to finish, and we want to give our bodies time to come down. It's really important for the biology of the brain, rather, to know that there's no light left. It's not day. I'm not confusing you. There's no light. If you find that watching TV or playing a game on your phone is helpful for you to go to sleep, then just limit the amount of time that you spend and download an app like the one I've got in brackets there called Flux, and it is supposed to have a full stop, so you can make a note of that, f.flux, on your laptop or on your phone, and that kind of limits the amount of blue light that's being emitted. Then we're going to also block out all other lights, so moonlight, your neighbor's light, street lights, small little lights in the room, like on your alarm clock or on your phone. We want to try and block those out so that we're not getting any kind of light signaling during the night. We want to use 100% cotton and breathable linen and sleepwear. We want to be wearing really breathable fabric so that we don't sweat, so that we don't overheat, so that we are warm enough. And then to sleep on a firm and clean mattress with clean linen. Okay, it really does make a difference to your sleep from a sensory point of view, but also a large number of people are actually allergic to dust mites. And I think, yeah, if you're not cleaning your mattress every so often, it could be very likely that you have disturbed sleep because you are allergic to dust mites. We want to avoid large and heavy meals within 2 hours of going to sleep. And we also don't want to be hungry before bed. So having a little snack before bed if you're hungry is fine. A small snack that can be easily digested and normally has a little bit of protein is normally a good idea. So something like a banana or a little piece of, like a handful of nuts is fine. Minimize noise as much as possible, obviously. And if you are really sensitive to silence, the sound of silence, or you have noisy neighbors or a barking dog, you can use something like white or pink noise, and there's some apps that you can download, or you can just play it off YouTube. And this last one is really, really important. And this is to reserve the bedroom for sleep and sex only at all times of the day. So you never, ever, ever want to be working in your bed. You never, ever, ever want to be doing anything stressful in your bedroom, or anything that requires alertness or cognitive focus, because you want the bed to only associated with sleep or sex, so that when you get into bed, that is what your body wants to do. What about napping? So I'm nearly done. This is 2 more slides, I think. So just a quick note on napping. If you really need to nap, and it's every now and then, it's fine. So you want to aim at having about a 20-minute nap, and this is before you get into a deep sleep of your cycle, or a 1.5 hour sleep, because this is normally when a cycle is finished. And so you don't want to wake up in the middle of a cycle. You don't want to wake up in deep sleep because you'll feel quite groggy and it takes a long time to wake up after that. So aim for either 20 to 30 minutes or an hour and a half, nothing in between that. And you want to finish your nap at 3 p.m. because this is when this will then allow you some time to build up your sleep pressure again for the nighttime. Okay, so just some takeaways is to take with you. Remember that sleep is based on biology. It's not just a case of closing your eyes and falling asleep. There are processes happening in your body, and you can either work with your biology or against it. Now that you understand how it works, make sure you're working with it. Then to also remember to not sacrifice any part of your sleep. So the beginning stages of sleep and the end stages of sleep are really important. So you need that full spectrum of your sleep staging. Good sleep is based on quantity, but also quality. So the depth of your sleep and the consolidation. We don't want interruptions. And to remember that bad sleep increases your risk for a lot of chronic diseases. So it really is important to value your sleep. Please prioritize it. And then I've just highlighted my 2 favorite sleep hygiene principles, which is regular sleep and waking time to keep circadian rhythm aligned, and to reserve the bedroom for sleep and sex only at all times of the day. So thank you for having me. I know it was a lot of information, and I hope that you learned something, and I hope that you've got questions. Thank you.
Thank you. We do certainly have questions, Tanya. And I think we all got the lesson loud and clear that we need to prioritize sleep. But some of the questions that we've got so far is, where can one go to get assessed for a sleep disorder? So I think we may have listened into today's session and we start diagnosing ourselves, or where can we get professionally diagnosed? So you did mention going to a GP, but if we don't go to our GP, where can we actually go get proper assessment? Maybe if you can just read.
Okay, so depending on what sleep disorder you think you might have, let's say you think it's insomnia, that you can go to a GP who's a little bit versed in sleep. You want somebody who knows what's going on in the sleep realm. So you can just ask that question. Otherwise, you can go to a sleep practitioner like myself, or like a psychologist, or another counselor that may have extra training in sleep, because that kind of diagnosis is a bit more straightforward. But then something like a obstructive sleep apnea, or periodic limb movement, these kinds of things that happen where you have to observe the person sleeping, this needs to be diagnosed in a sleep lab with those polysomnography, so the special equipment, and the specialized sleep technicians. So these you'll find various labs, you'll find them all over the country, and they're often run by like neurologists or neurophysiologists, that kind of thing. So you can really just Google sleep labs. But if you're in Joburg, there's a brilliant one at Morningside run by a man named Dr. Rothman. There's also a lady in Joburg named Dr. Alison Bentley. She's actually a GP, but she specializes in sleep, and she's amazing. So she will know exactly where to send you from go. So unfortunately, there's only a handful of sleep specialists in our country. But if you'd like more information, please, you're welcome to get hold of me, or you're welcome to send out my details, and I can forward on or refer you where you need to go. But yeah, I think it's either that, it's either going to be a sleep lab, or it's going to be somebody like a sleep practitioner who knows how to get the ball rolling for you.
Thanks, Tanya. That's very helpful. Another question that we have is, are sleeping pills helpful? Should we be taking sleeping pills?
Okay, so sleeping pills, so I'm just going to clarify what that is, are normally sedatives. And are normally the ones that are given are called benzodiazepines, and these are brilliant in terms of sedation. So what they do is calm down the whole body, and they calm the brain to a point where you can then fall asleep. The point of them, so the reason that they were developed in terms of helping people with sleep, is for a short-term fix. So it should not be taken for longer than 2 weeks. And unfortunately, a lot of doctors don't know this, but it needs to be given out for 2 weeks only. Thereafter, it becomes ineffective for sleep, and it can worsen sleep in the long term. So the point of it is to help you get back on track, to be able to get to sleep on time, and then to start using better habits to continue that good sleep.
So we stay on them for too long, generally.
Yeah, definitely. A lot of people think that it's like a chronic medication that they need to take forever and ever. It's different if you're on it for anxiety, but I'm talking about if you're on it because of sleep problems. You don't need to be on it forever, and it's very difficult to come off it. So if you are using sleep pills, because they are addictive, and you need to come off it and wean off it with the help of a psychiatrist, or with the doctor that put you on them. And then you need to look at how to use behavioral strategies to help you sleep instead. And this is seen as much more effective. All the research points towards cognitive behavioral approaches over any kind of medication. And the way you can look at sleeping pills is that there's nothing wrong with them to help you get to sleep initially, for an initial period. But what it's doing, any kind of sedative, is knocking you out. if you want to put it that way. Kind of like when you drink too much alcohol and it knocks you out. So are you going to say alcohol helps you sleep? You might. It might help you fall asleep. It does. But it's not going to allow for that beautiful staging and beautiful cycling of sleep that we need. It's either going to affect your deep sleep or your REM sleep, or it's going to give you too much or too little of something, and your quality is not going to be good. And unfortunately, sleeping tablets do that as well. They don't allow for natural sleep.
Is that why you then wake up feeling tired? So you're not really feeling rested?
Yes.
Understood. Yes. Another question that we have, Tanya, is which position is the best to sleep in?
So this
is there a position that's it?
Yeah, it's normally a preference, like a unique preference to you. But they do say sleeping on your left side is better for sleep. For a couple of reasons, I believe that it assists with circulation because there's less pressure on a very major blood vessel that runs down closer to the right side of the body, and also it's better for digestion apparently. So that's what I know about it. On your left side is the best position, but there are no bad positions if you're talking about like normal positions of sleeping.
Right or wrong way.
Yeah.
One of the things that you mentioned, and there's a question that we have around this, is COVID insomnia. What is it and can it be treated? I know that when I had COVID in February, I struggled to sleep, but how does one get treated for it?
So what it really is it's really insomnia. So it's normal insomnia brought on by the coronavirus. So there's still a lot of research going on, but with a lot of illnesses, even just the flu virus, we tend to have worse sleep. Okay, so you're not going to be sleeping well if you've got pain, if you've got discomfort, if you're on certain medications, your sleep is going to be interrupted. And then what's going to happen is you're probably going to take on bad habits to help you sleep. So we call this beginning part an acute insomnia, which can happen when you lose a loved one, or you're grieving, or you are ill, or for a short period your sleep is interrupted. We call this acute insomnia, which is okay. Normally you should get over that after the trigger is gone. So let's say once your corona is better, we should expect sleep to go back to normal. But the problem is that we take on bad habits and compensatory methods to try and get back to sleep or get to sleep more. So let's say you're ill at the time and you can't sleep at night. So then what do? You take on napping every day, or you sleep in on the weekends, or you try and watch more TV through the night. So or we start taking medications, or we start relying on alcohol. So there's a lot of compensatory methods that we take on because we're so desperate for sleep. And then what happens is the trigger, which is COVID, starts to dissipate and might get better or out the system. But now we have to deal with the bad habits. So now we call this chronic insomnia. And now this insomnia needs to be treated from a behavioral point of view because there's no longer an underlying problem or condition. It's now because we have taken on poor habits. But let's say that that's one case, and let's say that you haven't taken on bad habits and nothing has changed. We're starting to see that this corona insomnia can also be a case of what we call chronic fatigue syndrome, which is being linked now with corona. And that's just whenever a virus attacks your body goes into like a survival mode, and it tries to get you to sleep, it gets you to lie down, it makes you aware of pain in your body, it makes you sensitive so that you can do something about this virus. And then some viruses, just even when the virus is sort of sorted, this response in your body, this panic
still remains,
doesn't go away. Yeah. So then you end up with this constant alertness and sensitivity when you don't need it anymore. So that we call chronic fatigue syndrome.
And you can't flush it out. Makes perfect sense. Makes perfect sense. There's another question from Anonymous. I know that I don't want my room completely dark. I sleep with a little bit of light. Is this unusual? And obviously, will this affect their sleep? Because one of the things that you mentioned was keeping as little light as possible.
So obviously I'm talking about research-based strategies. But when we come to actual clinical examples or examples of just people, real people, we're going to look at a lot of different environments and a lot of different situations. So your preferences do make a difference. And if you feel like you sleep better with the light on, then that's cool. And it's not unusual at all. There's a lot of adults with fear of the dark, or it's just a case of feeling comfortable. And it could come from childhood, or it could just be a case of not wanting to trip over things when you have to get up and go to the loo. So what I'd suggest is, if you do have to have a light on, just make sure it's not a bright white bulb. And preferably, you can pop to a hardware store and just go buy like a red bulb. So the red bulb is pretty much the opposite of blue light. So it's really like mimicking a really low, dull, warm, and even romantic kind of lighting that keeps you relaxed if you do wake up. So if you wake up, you can still see that you're not going to be alerted to waking up completely. So your melatonin is not going to be as affected.
Another question is, thank you. Another question, Tanya, is, so a nightcap, you said no alcohol before sleep is completely out of the question. Well, is that not advisable at all then?
No, it's not advisable. It's not a real thing.
So that's a fallacy. No nightcaps anymore.
No nightcaps. Because what a nightcap does, if you're finding it helping you, it's just knocking you out, getting somebody to punch you in the face, really. So it's knocking you out, but it's not going to, again, it's not going to mimic that nice sleep that you want.
One last question. I recently found out that I drink coffee at midnight. I do struggle with sleep. Also, on some nights, I find myself waking up with a song in my head that tends to disrupt my sleep. Any suggestions? That's our last question.
Okay, I'm looking at the question. It does say after 12. I'm assuming that's actually midday. You said
12 midday. Pardon me. Yes,
yeah.
It's actually 12 midday.
Yeah. So that's, so we all have different sensitivities to caffeine, and that's a genetic thing. So some people are more sensitive. I'm very sensitive to caffeine, so I don't touch it. Some people aren't at all, and they find that they can sleep perfectly fine with a cup of coffee before sleeping. But yeah, if you found that yourself, that you struggle to sleep even after 12 o'clock, then that's great that you realize that, and obviously you're going to limit it quite a lot. Just be sure that you know what else has caffeine in. So it's not only coffee, because if you are that sensitive to caffeine and you are still struggling with sleep, even though you are stopping before 12, you might want to look at things like medications, vitamins, supplements, and other foods that you might be taking that are affecting your sleep because of the caffeine content. And then you said also some nights you wake up with a song in your head. So look, it's very difficult to suggest anything concrete, because I don't know the other factors. But what's likely happening is that you're not completely relaxed when you go to bed or when you go to sleep, which is a case for most of us. We need to wind down completely before sleep. We want to get out of any kind of stress or tension. We don't want to be thinking when we fall asleep. You really need to wind down properly. And so what's probably happening is that you're a little bit hypervigilant, which means that your brain is still on the whole time that you're sleeping. It's not, not that your brain switches off, but there's parts of your brain that switch off during sleep. And it's possible that because of stress or anxiety or just not winding down properly, your brain is still in this alert state when you go to sleep. So you want to maybe adopt things like meditation, breathing. All of those work really well. Well, for some people, I'll say. Or any other healthy habits in terms of the sleep hygiene, or you can get some help if you need it to relax before sleep.
Thank you, Tanya. Thank you so much. And definitely like to extend a big pearl thank you for affording us your time today. And I hope everyone took something away from this session and we get some good night's sleep today, 7 to 9 hours this evening. And just a reminder that we'll have our next session of the core series next week, Tuesday, same time and same place. And today's quote is, Tide's mind, don't plan well. So sleep first and plan later. Have a wonderful afternoon. And for those in South Africa, happy Heritage Day on Friday and enjoy the public holiday. Goodbye.